34. Describe disposable gloves, good and bad qualities. Good qualities. The primary purpose of disposable gloves in a healthcare setting is to act as a physical barrier between healthcare professionals and patients, helping to prevent cross-contamination. As they are disposed of after use, there is a decreased risk of transmitting infections compared to reusable gloves. Bad qualities. Latex gloves may cause allergies in some people, and are therefore unsuitable for everyone. Not all disposable gloves provide a good fit or are comfortable for long-term wear. Disposable gloves, especially thin ones, are prone to puncture or tear, which can put healthcare professionals at risk. Prolonged use can lead to skin irritation or dermatitis, especially with latex gloves. Some disposable gloves may hinder the tactile sensitivity of the user, which could impact their ability to perform delicate tasks. 35. What is a hematoma and what are causes of this condition? Hematoma. Localized collection of blood in the tissue resulting from a break in the wall of the blood vessel. 36. What is a normal blood pressure for an adult? Systolic less than 120 mm Hg. Diastolic less than 80 mm Hg. There are two numbers as the reading of a blood pressure. Which number represents systolic and which represents diastolic? Systolic measurements are recorded over diastolic measurements, x, 120/80ths of a millimeter Hg. What is the difference between systolic and diastolic? Systolic. When the heart is in its contracting phase. Diastolic. When the heart is in its relaxation phase. 37. Define the following terms: assimilation, consensus, consortium, and bias. Assimilation. Process by which people of diverse backgrounds slowly give up their original cultural language and identity and melt into another, usually larger, group. Consensus. General agreement among the members of a group or community. Google. Consortium. An association, typically of several business companies. Google. Bias. Prejudice. Thinking negatively of others without any or significant justification. Generally a combination of stereotyped beliefs and negative attitudes. 38. Define the following terms: ethnocentrism, identity, and biculturalism. Ethnocentrism. Tendency of some individuals to view norms and values of their own culture as the only acceptable ones and to use them as the standard by which all other cultures are measured. Identity. The distinguishing character or personality of an individual. Biculturalism is the ability of individuals to be able to competently negotiate two or more cultures, the mainstream culture and individual's own culture. 39. What is the cart's name used in emergent situations? Crash cart. 40. Describe the various types of shock: vasogenic, anaphylactic, hypovolemic, cardiogenic, and septic. Vasogenic. Caused by sepsis, deep anesthesia, or anaphylaxis. Anaphylactic. A type of vasogenic shock. Most common type of shock encountered in medical imaging. Occur with contrast media administration. Hypovolemic. Caused by loss of blood or tissue fluid. Cardiogenic. Caused by a variety of cardiac disorders, including myocardial infarction. Septic. A medical condition as a result of severe infection, sepsis. The microbes may be localized or systemic. 41. Diseases can be caused by various means of transmission. Describe airborne route, droplet contact, a vehicle, a vector, and direct contact. Airborne route. Transmission of an infectious agent from an infected person or an environmental source which had been suspended in the air on dust particles or dried residual of droplets, droplet nuclei. Droplet contact. Transmission of an infectious agent in a spray of droplets projected by coughing, sneezing, etc. from an infected person at close range to the mucous membranes of the eyes, nose, or mouth of a susceptible person. Vehicle-borne, indirect contact. Transmission of an infectious agent from an infected person to a susceptible person via intermediate objects, such as surgical instruments, the surfaces of patient care equipment items, or the hands of healthcare workers. Vector-borne, indirect contact. Infections transmitted by insects and animals to people. Direct contact. Immediate transfer of an infectious agent from an infected person to a susceptible person by physical contact. 42. Describe pathogenic organisms. Pathogenic organisms, also known as pathogens, are any microorganisms, such as bacteria, viruses, fungi, and parasites that can cause diseases in their host. 43. Describe fungi, molds, bacteria, and viruses. Name several of each type. Fungi, general term used to denote a group of eukaryotic protists, including mushrooms, yeasts, rusts, molds, and smuts, that are characterized by the absence of chlorophyll and by the presence of a rigid cell wall. A mold is one of the structures that certain fungi can form. The dust-like, colored appearance of molds is due to the formation of spores containing fungal secondary metabolites. The spores are the dispersal units of the fungi. Not all fungi form molds. Examples of fungi. Diseases caused by fungi can be of 4 different classifications. The first is a superficial infection, which usually causes discoloration of the skin. Tinea nigra is a fungal infection that results in a painless black or brown discoloration of the palmar surface of the hand and the plantar surface of the foot. Second are the cutaneous infections, which involve the keratinized tissues of the hair, nails, and skin. The most common clinical infection in this group is tinea pedis, or athlete's foot. The growth pattern of this fungus forms a ring and is also known as ringworm. The third type is a subcutaneous fungal infection that enters the human host as a result of trauma to the skin. The fourth type is characterized by a systemic infection that enters the circulatory and lymphatic systems and may be fatal. Bacteria, microscopic single-celled organisms with a simple internal organization. Bacteria are prokaryotic rather than eukaryotic organisms. Examples: streptococcal pharyngitis, strep throat, bacterial pneumonia, and food poisoning. Viruses much simpler in form than bacteria or animal cells. Viruses are neither prokaryotic nor eukaryotic. They are considered obligate intracellular parasites. Viruses cannot live outside a living cell. They lack the components necessary for their own survival because of their inability to synthesize specific required proteins. Viruses depend on the host cell to provide these missing factors. A virus carries its own genetic information in the form of deoxyribonucleic acid, DNA, or ribonucleic acid, RNA, but never both. Examples: common cold, infectious mononucleosis, and warts. What is the treatment for the various types of organisms noted? Vaccination, antifungal medications, antibiotics, antiviral medications. 44. What is the purpose of CPR? CPR significantly reduces the chances of permanent organ damage or death when cardiac arrest occurs, which stops cardiac output. The goal of CPR is to keep oxygen flowing in and out of the lungs and to keep oxygenated blood flowing through the body. Where are hands placed during CPR? Use the hand to find the lower edge of the rib cage and run the middle and index fingers along the lower edge to the point where the ribs meet the sternum. Place the middle finger at this notch, and then place the heel of the other hand on the sternum next to the index finger. The heel of the hand should rest along the length of the sternum. The other hand is placed on top of the first, and the fingers of both are interlaced and extended to prevent their tips from applying inadvertent pressure on the ribs. The elbows are locked with the arms extended directly over the patient's sternum, and compression is applied straight down from the shoulders. When can CPR be stopped? Person is tired, physician calls it, downed power lines, traffic, fire. 45. What is your actions for the client with an epistaxis, nosebleed? Lean patient forward and pinch the affected nostril against the midline nasal cartilage with digital pressure with the fingers. Patients should not be put in a recumbent position or instructed to tilt the head backward because this action allows the blood to flow down the throat, resulting in the patient swallowing it. If gentle pressure fails to stop the blood flow, a moist compress may also be applied, which will stop most nosebleeds. If these actions are not effective within 15 minutes, medical assistance should be obtained. 46. What are side effects of medication? Consequence other than the one for which a drug is used. Name some of the side effects that may be noted with medications. Gastrointestinal issues, including nausea, constipation and diarrhea, drowsiness, pain and skin reactions. 47. What is extravasation and when would you see this? Discharge or escape of fluid from a vessel into the surrounding tissue. This can cause localized vasoconstriction, resulting in sloughing of tissue and tissue necrosis if not reversed with an antidote. This can happen when injecting contrast in a patient. What is your action should this occur? Remove the needle, apply pressure to the injection site, and apply moist heat pack to relieve the discomfort. If the extravasation involves a corrosive drug, immediate attention is needed to prevent tissue necrosis. When a corrosive drug infiltrates the tissue, a cold pack rather than heat should be applied to the site, and the physician and pharmacy must be notified. 48. Common contrast agent used in MRI? Gadolinium. 49. BUN and creatinine are lab studies to monitor values related to a specific organ of the body. Which is? Liver. 50. As an MR tech, you should be aware of locations of specific equipment. What are these items? Emergency, crash, cart, AED. 51. How long after the heart stops beating might brain cells begin to die? 4-6 minutes. 52. Describe the difference between pharmacokinetics and pharmacodynamics. Pharmacokinetics study of the metabolism and action of drugs with particular emphasis on the time required for absorption, duration of action, distribution in the body, and method of excretion. Pharmacodynamics is the branch of pharmacology concerned with the effects of drugs and the mechanism of their action. Difference is: pharmacokinetics is the study of what the body does to the drug, and pharmacodynamics is the study of what the drug does to the body. What is the acronym for pharmacokinetics? PK. 53. When moving client to scanning table with wheelchair, what angle to table is chair placed at? 45 degrees. Prior to lifting a client, what is your responsibility? 1. Move the wheelchair footrests out of the way. 2. Be sure that the wheelchair wheels are locked. 3. Have the patient sit on the edge of the wheelchair seat. If performing two-person lift, what is your responsibility and client positioning? The stronger person should lift the patient's torso while the second person lifts the patient's feet. The person lifting the patient's torso usually directs the other person's actions. Prepare for the transfer by verbally planning out the procedure. This verbal planning enables a coordinated effort among the people doing the transfer and the patient. Begin with the wheelchair. Lock the wheelchair wheels, remove the armrests, and swing away or remove the leg rests. Ask the patient to cross his or her arms over the chest. The stronger person stands behind the patient, reaches under the patient's axilla, and grasps the patient's crossed forearms. The second person should squat in front of the patient and cradle the patient's thighs in one hand and calves in the other hand. On command, the patient is lifted to clear the wheelchair and is moved as a unit to the desired place. 54. What are the purposes of using sandbags during a scan? Sandbags are useful positioning and immobilization devices and can be used in a variety of ways. By themselves or in combination with positioning sponges, sandbags are extremely helpful in reducing voluntary motion. What is your responsibility when using sandbag and why? Technologist cannot place in such a way that diagnostic information is obscured within the anatomic area of interest. They must be placed gently on or against the areas adjacent to the anatomic area of interest so as not to injure or cause further damage. 55. What is a civil wrong called? Tort. Definition of tort: a patient's claim that he or she has been wronged or has sustained some injury, other than a breach of contract, and for which cause may exist for an action to receive compensation for damages is known as a tort. 56. What is the best method to ask a client about their pain? Open-ended questions, non-directed, non-leading, let the patient tell the story. Facilitation: nod or say yes, okay, go on. Encourages elaboration. Silence: to give the patient time to remember, facilitates accuracy and elaboration. Probing questions: to focus the interview, provide more detail. Repetition: rewording, clarifies information. Summarization: condensing, verifies accuracy. 57. Vital signs give us a window of body homeostasis and is maintained by a physiologic feedback loop. Why is it important to monitor vital signs? Vital signs are measurements of the body's most basic functions. Vital signs are primary mechanisms that adapt to responses, inside or outside the body, to maintain homeostasis. Name the vital signs that are monitored. Body temperature, pulse rate, blood pressure, and respiratory rate. 58. What is epinephrine? What is another name for this drug? Epinephrine is a hormone and a neurotransmitter. Plays a crucial role in the body's fight or flight response. helping to prepare the body to respond to stress or danger. When released into the bloodstream, it increases heart rate, dilates airways, and redirects blood flow to essential organs, among other effects. Another name: adrenaline. When is this used? Used for emergency treatment of severe allergic reactions, including anaphylaxis to insect bites or stings, medicines, foods, or other substances. 59. What is fidelity? Defined as faithfulness to a person, belief, or cause. Demonstrated by being loyal and supportive. In nursing, it means nurses must remain true to professional promises such as the promise to provide high-quality, competent, safe, and efficient patient care. 60. Describe the term res ipsa loquitur. Res ipsa loquitur is a Latin legal term that translates to "the thing speaks for itself." It is a legal doctrine used in tort law to establish a presumption of negligence on the part of the defendant based on the circumstances of the injury or harm suffered by the plaintiff.